Hi, my name is Jamie, and I am a student at Indiana State University in the LPN to BSN program, and I am taking currently nursing 444, and I'm here today to talk to you about congestive heart failure. Today we will be talking about the population at risk, signs and symptoms, prevention, different programs, treatments, and references. Down below you will find a link to a pre and post test, and there's also a link to a brochure that you are free to print and hand out. The pre-test, if you could pause right here and go down and take the pre-test and then finish the presentation and then come back and take the post-test to see if you learned anything. Our population at risk are those adults 65 and older. Our objectives today are to know 3 signs of congestive heart failure, know 2 preventable causes, and know what to do when there is an issue. What is congestive heart failure? Congestive heart failure occurs when your heart muscle is not pumping your blood as well as it should. This could be caused by narrowed arteries or high blood pressure. Some signs or symptoms to congestive heart failure exacerbations are shortness of breath with activity, trouble breathing when lying down, weight gain that's rapid, swelling to feet, ankles, or legs, generalized weakness and tiredness, swelling also to the abdomen, sometimes your hands as well. It's important if you do have congestive heart failure to monitor your edema to your feet and ankles. If you can press indent in and it doesn't go away and there's a mark there, then you are probably retaining too much fluid. There are ways to prevent congestive heart failure and exacerbations to it, and that would be to stay at a healthy weight. It's easier to breathe and it's easier for your body, your heart, to pump the blood through when you're at an optimal weight. Exercising daily, although it's really hard if you do have congestive heart failure to exercise because you get really short of breath easily. Eating a balanced diet, limiting fat, sugar, and salt in your diet, especially avoid the salt shaker. Most food already has enough sodium in it for your daily limit. Avoiding alcohol and smoking, reduce your stress, and keep your blood pressure under control. There are many foods you should avoid if you do have congestive heart failure. Avoid adding salt to foods. Canned and pre-made processed foods are high in sodium. Ham is high. Fast foods. Chinese food is really high in sodium, and a lot of condiments you need to be careful of as well. All these things adding sodium to your body cause you to retain fluid, and it makes it harder for your heart to pump. If you do have congestive heart failure, you should monitor yourself regularly. Daily weights, if you have more than a 3-pound weight gain overnight, then you should probably call your doctor. Some doctors know their patients well enough that they give them some guidelines that if they've gained a little bit of weight to increase their Lasix and such. But if you're new to it, then you definitely need to be contacting your doctor. You should also weigh yourself at the same time every day with the same type of clothing on or completely naked so that you know what your weight is. Having regular checkups and exams, usually those include with a cardiologist, and they do monitor your ejection fraction by doing an echo on an annual or biannual basis to see if how effectively your heart is pumping. You should maintain taking your maintenance medications for blood pressure, diabetes, or any other chronic disease that you have, because you need your body to be at an optimal health. Home health can also come in and help you with monitoring these things if you are unable to do that on your own or you don't have a loved one that can help you. There are many treatments to congestive heart failure. There's medications. Most of them are for blood pressure to keep your blood pressure optimal. There's ACE inhibitors, beta blockers are all used for congestive heart failure. Diuretics such as Lasix or spirolactone, aldactone, metalazone, all of those help with fluid. If you do take Lasix, a lot of times it's a potassium depleting medication, and you would need to take potassium supplements so that you don't end up having other heart issues and losing too much fluid. There's a big balance that the doctors need to monitor when you do take Lasix or one of the other diuretics, because you don't want to get too dry as well and be dehydrated, because that can cause other issues. You need to get daily physical activity. Sometimes you need to have an LVAD placed to help with your heart and pumping effectively. Valves are sometimes bad, so you need to have a valve surgery. Transplants, if you have a defective heart, whether it be genetic or you've damaged it in some other way. Bypass surgeries to fix the narrowed arteries to help your heart pump more effectively. Fluid restrictive diets, limiting your fluid intake so your body doesn't have to pump too much out, and then reducing your sodium intake as well. There are many different programs out there to help those with congestive heart failure, because it is a very expensive chronic disease and it causes a lot of hospital admissions when there is an exacerbation, and it is hard to treat. Sometimes the reasons you need to be hospitalized if you've taken on too much fluid, sometimes you need to be on a Lasix drip or have the doctors be monitoring and adjusting your medications while you're being monitored. Home health is out there to help. If you are unable to get out and about, they can come into your house. The nurse can check on your medications, check your blood pressure, listen to your heart and lungs to see if you've taken on fluid. There's also community paramedics in some communities that do provide the same type of services for a very low cost. Sometimes the hospitals or communities have grants that they have covered that community paramedic with. If you are a veteran, the VA has a lot of programs out there for those with congestive heart failure for preventing hospital admissions. It is a big deal for Medicare patients, especially. The hospitals try to prevent them from being admitted to the hospital, so there's a lot of monitoring and assistance out there to help keep them from being hospitalized. If you're unsure or you need help with your diet, exercise, or monitoring any of these things, be sure to ask your primary care doctor or your cardiologist, and they probably know some of the programs out there to help you with dealing with your congestive heart failure, because exacerbations can hit rather rapidly, and then you can be in a dire straits and need assistance immediately, or you could end up dying from it. Congestive heart failure affects a large number of the population, and it is a serious disease that affects many. Thank you for listening to me today, and I hope that you find the brochure helpful and informative and are able to pass that along to other people.